Good afternoon. I'm Dr. Doug Drevets. I'm the Chief of Infectious Diseases at OUHSC, and I'm here to field questions from the media regarding COVID-19.
All right, we'll get right into it. Kelsey at K4 is asking, is it possible for staff at a doctor's office to have a strong enough immune system to fight off the virus?
So that's a great question. The question is it possible for folks at a doctor's office, or really anybody, to have a strong enough immune system to fight off the virus? And that is true. In fact, most people's immune system will be strong enough to fight off the virus without serious problems. The issues really are that when you're doing that, you are going to be able to transmit the virus to other people for some period of time. And that's the critical thing. The other thing is, often you don't know what your response to the virus will be until you get it. So you can't plan to have that, but more than likely, most people who are younger and healthier are going to do okay.
So we don't really know yet, I suppose, if somebody could just plain have natural immunity to this particular virus, right? Doesn't seem that way since there's so much of it.
So that's a good question, April. And the issue is natural immunity versus specific immunity. And by natural immunity, you mean pre-existing antibodies or, in a sense, pre-existing T-cell immunity. And in fact, most people, the vast majority of people, have none of that. So we are all highly susceptible to acquire the disease, to get infected by it. When that happens, most of us will have an immune system that will be just fine. It will make antibodies, it will make cell-mediated immune responses, and we will overcome the virus without a problem. But then again, there are a lot of people who do not have sufficient ability to overcome the virus, or who have severe underlying health problems that are going to make them at high risk for a bad outcome.
That just reminded me of something I read this weekend about different blood types. Is that just something they're looking at? If some blood types seem to be able to fight it off better than others?
Right, so there was some early suggestions, I think out of China, that a particular blood type, the folks who had that blood type, had a less severe course of the disease. Now, I think that's still under investigation.
Do we think it's possible there were cases of COVID here back in the U.S. back in November?
So the question is, do we think it's possible that there were cases of COVID-19 back in November in the United States? You know, I think it's possible, but it's highly unlikely. There will be a lot of folks looking for that, and I think the most recent data suggests that in China, that's where they were first starting to originate, was somewhere in the middle to late fall. Now, it's unknown when it came to the US. So far, the earliest ones, I think, are from early February on autopsy studies. So I think it is unlikely that we were seeing it as early as November. Perhaps our earliest date will get pushed back by a few weeks, and I think we will know that eventually.
Okay, this one says, I know we've asked this question a million times, but please clarify, are masks harmful if you wear them for an extended period of time?
So the question is, are masks harmful if you wear them for an extended period of time? And the answer is, in general, no. They're not harmful to you. They're not harmful to other people. The situations with extended use become some masks, if they get wet, like from speaking, like this paper mask that I'm wearing, over time they will break down, and so they lose their effectiveness. Also, there is the issue that if I'm seeing a patient with a disease that requires contact isolation, then it is possible that the mask on the outside gets contaminated by something in the environment, and that's when you need to change it. But in general, we're not harmed by wearing the same mask over and over. They do need to be cleaned, and they will lose their effectiveness over time.
Okay. And how important is mask wearing in stopping the spread of COVID in Oklahoma?
So right, the question is, how important is mask wearing to stopping the spread of COVID-19 in Oklahoma? And right now, I would say it is of critical importance. In fact, it is the single most important thing that we can do right now to slow the spread and stop the spread right now.
Okay. The CDC updated their self-isolation guidelines to no longer needing a negative test. They say most people can self-isolate for 10 days after symptoms begin and 24 hours after their fever has broken. Is this something we recommend, or can you expand on why they've changed that?
So just over the weekend, the Centers for Disease Control updated their guidelines on self-isolation and on issues such as return to work after having had COVID-19. And the important thing is that they are no longer requiring testing before returning to work. And they think that for most people, people who have mild to moderate diseases and who are not immunosuppressed, 10 days after the start of symptoms and at least 24 hours after having no fever and not taking any medicine that would suppress a fever and having some improvement in your symptoms would be sufficient. This comes from new data and experience literally worldwide showing that most people are going to clear the infection within 10 days of having symptoms, assuming that they are getting better. The other thing that it points out is that the PCR test that we often do to diagnose it will continue to pick up fragments of dead virus for quite a long time after that. But there are several studies showing that you cannot retrieve live virus from individuals after about that point in time. So that's really what the recognition, this new science has led to the recognition that we can stop repeat testing for most folks and allow people to come back to work or to stop self-isolating after around 10 days, provided they have no fever and they're getting better.
That's interesting. So people can still have a positive test but no longer be contagious?
That is correct. With the PCR testing, people can have a positive test, but it does not mean they're contagious. And this is somewhat strange in some senses, but for those of us who work in infectious diseases all the time, it is not an uncommon situation where you can find, in a sense, microbial footprints in folks, but it doesn't mean that they're able to transmit the infection.
Okay, Cassie with the Frontier wanted to go back to the masks real quick, and she's asking, with cities implementing mask mandates, can we expect cases to eventually start declining? And if so, how long would it take to see effects from the mandates?
So the question is that as cities implement mask mandates, can we expect to see cases decline, and when will that happen? We can certainly hope that cases will decline, and that depends on how good people are at complying with the mask mandate. And to what extent are they wearing reasonable masks? If you just take a one-ply cloth mask, a very thin material, because you really don't want to wear a mask and this is what allows the most airflow, and that's what you use as a mask, or say a bandana that's just one fold, it's really not going to be very effective. If you have a multi-layer cloth mask or a surgical mask such as I'm wearing or something else, it will be effective. So we will start seeing eventually a decrease in spread. It will take, on average, around a week to 2 weeks really to start picking up on that, because folks who are already infected will eventually manifest their symptoms, their disease, and that always takes some time. And so you're stopping new infections, and it will take on the order of 1 to 2 weeks for us to see that happening in decreasing numbers of cases.
Okay, so say this really loud. I don't know if they can hear me, but we are not going to be talking about the surge plan because that's not your area. Somebody else, there's other people that are involved in that. But one of the reporters was asking just what are we seeing in hospitals?
So the question is what's happening in the hospitals right now? And all I know is the big picture, and the big picture shows that we have, I think, more hospitalizations now for COVID-19 than we have had since this whole pandemic started. And according to Dr. Dale Bratzler, who is OU's chief COVID officer, I believe close to 50% of those individuals are in intensive care units. So in a sense, we do have a large number of folks in the hospital, and even today, the Oklahoma State Health Department reported over 100 new hospitalizations. So a lot is happening at the hospital level.
there any new treatments that we've been seeing recently, or?
I wouldn't say there are any new treatments. I think that we are getting better at using what's known. And when I say new, I mean in the last week. Over the last couple of months, we've learned that remdesivir is a useful antiviral. We're trying to use that more and more as often as possible, and hopefully as the supply increases, we'll be able to use that even more, and it'll be better the sooner we can get that to people. The other thing is just using corticosteroids more prudently in the hospital is also helping. And then positioning people, it's called proning. They seem to retain their ability to bring oxygen into their blood better also. So I think we're getting better at things. We're also certainly aware that most people with COVID have a real issue with clotting and throwing clots to their lungs and other parts of their body. And so we are taking steps to prevent that.
This reporter's asking, when should Oklahomans be concerned about the way things are going?
Just a minute. So the question from the reporter is, when should Oklahomans be concerned about the way things are going? They should have been concerned months ago about the way things are going. And right now, the large numbers of cases that we're seeing is a manifestation that enough people are not concerned about it. And so we're having growing numbers of folks in the hospital, and this will continue until we see decreased numbers of infections. And the only practical way, the only possible way for that to happen right now is by mask wearing. According to the State Department of Health, less than 5% of folks in Oklahoma have antibodies to this disease, meaning they have some degree of immunity. That means more than 95% of folks in the state are completely susceptible to this infection. And so it's here, and we need to be concerned about it enough to act on it right now.
She wants to know if that would include possibly shutting down things again. What do you think?
So the issue is shutting down, so to speak, shutting down the economy. And, folks have to realize that it's not an either or. We need the economy to support healthcare. We need healthcare to take care of people. And so we really need to do both at the same time. And the best way to do that is to get really serious about mask wearing in public, mask wearing when we're in groups, limiting the numbers of groups that we're in, and limiting our exposure to other folks. So I think it's possible we can do both, and we really have to do both, and we have to do them together.
Okay. I don't have any more questions. What do you have that you want to wrap up with? Anything?
No.
Okay. Travis, any questions?